Hello, everyone. Welcome. We'll just give everybody a couple of seconds or a minute or so to get loaded into the webinar. So thank you for attending. All right. So greetings and welcome to our February webinar. I'm your host, Carolyn Ihde, the Small Ruminant Outreach Specialist for UW-Madison Division of Extension and Iowa State University Extension and Outreach. We will hear from a great speaker tonight, Dr. Rosie Busch from UC Davis Veterinary Medicine and Cooperative Extension. While we wait for everyone to join, we'll begin with a couple of quick polls and I will give you a few announcements. So thank you for participating in our polls. If I can. Understanding the demographics of our participants helps us improve extension programs and services. Asking for the following information also helps us meet our institutional requirements for compliance with federal non-discrimination policies. Providing us with this information is voluntary, and you are not required to fill out this form to participate in extension programs. If you have any questions about this form or why Extension collects the information, please contact Kim Woldman, Compliance Coordinator and Equity Strategist at UW-Madison Division of Extension. And like always, all of our polls are anonymous. So thank you very much, and we'll wait a little while. There's quite a few of you on here tonight, so that everybody has a chance to answer that. So thank you very much. Our goal in the small ruminant webinars is 80%, so hopefully that we can reach that tonight. All right, we have 3% to go. Oh, 1% to go. We're almost there. Awesome. Thank you so much, everyone. And I think we'll go ahead and end that poll if you would like. And as always, this is our favorite participant poll at Small Ruminant Webinars. We just like to ask a little bit about you and your operation so that our guest speakers are able to see who's on the webinar and get a little better understanding of who's with us tonight. So thank you for taking this poll. You may have to X out of the first poll so that you're able to see the second poll on your screens. Hey, we see a lot of people from Wisconsin here and a lot of people from out of this Wisconsin and Iowa. So thank you for joining us and connecting with us at a UW. Oh my goodness, we're at 87%. Do you think we can go for 90? That would be amazing. Just a couple more people, we're at 89%. All right, thank you so much. We hit it. I think I'm going to brag tomorrow to my colleagues that we hit 90% on a poll. So thank you very much. And we will move forward with our presentation. So I just have a couple of things that I want to make your producers aware of. One is the NOMS sheep study for 2024, and Dr. Rosie Busch, she may be able to add a little bit of information on this, maybe not. I don't want to put her on the spot, but if you've been asked to participate in the NOMS study, that would be great. And I just want to make sure that everybody who has been notified that they're part of the study, that they will go ahead and participate. If you want to know more about the NOMS sheep study, you are more than welcome to go ahead and access that information at aphies.usda.gov/NOMS. Thank you very much. And we'll move on to another survey, but and this one may be familiar for our speaker today. So we've been asked to promote this survey for information about raising goats on your farm. So if you can grab the link now, that's great. Or if you can contact us later and we can give you that information. But they're wanting to know about goat raising and how we can help and find out the problems that you may be having. And the third and the last announcement that I have is we'll be having a Badger Sheep short course at the Arlington Research Station in April on the 4th and 5th. And if you would like to attend or know more about that, just contact Todd or myself, or you can visit our website as well. And this is a Zoom webinar. As in the past, we've done actually a meeting. So things are going to run a little bit different than in the past. So we will be able to utilize your question and answer feature at the bottom of the page. And depending on the questions, we may answer them directly or wait until the end of the presentation. And we will be recording this session and it will be available at a later date on our Extension YouTube channel. And I will notify participants when the recording has been placed on our YouTube channel and the link for accessing it. After tonight's presentation, a survey will be available and the survey will appear on your computer screens once you have closed out of the webinar. And then it will also let Dr. Rosie Busch know how much you learned from the presentation, and it'll give us feedback on what types of topics you would like us to cover and what changes you have done or are thinking about doing in your operations. All right, I promise I'm done. And so we'll be, want to welcome our guest speaker today, Dr. Rosie Busch from UC Davis. She's an assistant specialist with Cooperative Extension. And I will let her take over and tell you about herself and begin her presentation. So thank you and welcome for joining us.
Yeah, thank you so much. Can you hear me okay?
Yes.
Perfect. Okay, let me share my screen. So I really am excited for the chance to speak with you guys and share some information. I have done webinars with the Iowa State Extension team before on kidding management. And so I just want to say that this will be different from that. That was more on like dairy goat facilities, how we would manage, to have healthy dairy goat kids from the start. This is going to be a little bit more talking about some of the most common causes of illnesses within the first few days after lambing and kidding. And then are some approaches that we can kind of think about to be prepared for those in the future. So I'm Dr. I totally skipped the introduction, but I just wanted to make sure everyone knew that this is going to be different than that one. If you had seen that one before, if you haven't, that one is available on the Iowa State Extension webpage for dairy goats. So I am Dr. Rosie Busch. I'm the sheep and goat extension veterinarian at UC Davis. So I'm in California. And I have had great opportunities to work with producers in California and in surrounding states as well, and recently have been to Canada. And so I'm excited for the opportunity to work with you guys. And if there are questions at the end, I'd be happy to take those, but we'll try to get through some of this. I don't have a huge slide deck here, so I think there should be an opportunity for discussion and questions once we get through here. Okay. So why are we talking about this today? So lamb and kid mortality, actually up 50% of pre-weaned lamb and kid mortality happens within the first 24 hours. So that's, can be up to 10% of all lambs and kids born alive. So these are studies that have been conducted over, internationally. We don't necessarily have these studies here in the US. But it is pretty striking how vulnerable the animals are once they're born. So a lot of these can be lost within 3 hours of birth. The study in Norway found that 41% of losses were within 24 hours of birth. And they also found that most of those were from litters of 3 or more. So we'll talk about some of the risk factors that contribute to these higher losses in the first 24 hours. The most common conditions that we lose lambs and kids to is freezing and starving lambs and kids. So hypothermia, hypoglycemia, we'll talk a little more about that. Trauma at birth or soon after, and then infectious causes like pneumonia, septic arthritis, and scours. So with cold and starving lambs, we can see these for a number of reasons. In extreme weather events, if we don't have shelter available, especially with rain and wind. I definitely get a lot of comments from folks that are like, oh, you're from California, you don't know what extreme weather is, but wet, cold rain and wind can definitely decrease the core body temperature of our neonates. So when we say shelter in these situations, certainly, barn lambing and kidding can be one way to manage to protect these most vulnerable stages. So within the first 24 hours, that's not always available for everyone in all of these different production systems that we have. So the other forms of shelter that help during lambing and kidding can be things like managing the topography of where your lambing grounds are. So if we know we're going to be lambing at a certain time of year, can we make sure that we can have access to slopes that are leaning a certain way? So we don't, if north winds affect us, can we have a south leaning slope so that we're protecting them from the winds? Can we have a pasture that has a lot of tree cover? Things like that can help provide shelter that's not necessarily a barn. Other practices that operations will do is shearing ewes before lambing so that they're more likely to have shelter-seeking behaviors. Obviously, goats aren't necessarily as insulated by fiber as wool sheep are, so that we don't need to shear them, but not all goats actually have an innate shelter-seeking behavior. So teaching our adult does how to, find shelter in brush if we don't have barns available is another way to try to keep them from being impacted by these weather events. We like to say that the best shelter is a full belly of milk. And so ewes that have a poor milk supply can really be a big reason for loss of lambs and kids within the first 24 hours. So making sure that we're monitoring for mastitis and, pulling animals out of the breeding group if they do have signs of chronic mastitis or OPP, would be really important to make sure that they're not having lambs that they can't support and protect. Poor bonding and mothering. So some of this can be just poor maternal behavior. We see that for sure. That's where shed lambing can really help in those situations. This is a great image or example of when young lambs start growing teeth if they weren't born with their teeth already broken through. So if you do have a ewe that maybe bonded to that lamb initially, and then the next day starts kicking them off, or you notice the lamb is, maybe you don't see her actually kicking the lamb off, but if you do have a cold lamb or kid, the first thing you would do is put your finger in their mouth and see, is it sharp? I mean, this would hurt my hands. And so I can imagine the mom not wanting this lamb to nurse. So once this lamb is warmed up, we can just file the sharp ends of the teeth with an emery board, and they pair up usually really nicely if the sharp teeth is the only reason for the lack of bonding at that time. Another reason is inexperienced dams. So I did switch to the low birth weight because this picture is a great example of a first time a ewe lamb that had a tiny little single, and her udder is pretty tight and sucked up because she is a first-time mom. So I just think it's a great example of her just not quite knowing how to handle this situation with this little lamb. That is, if you can see it, he's got his front feet off the ground because he's having to jump to get to be able to nurse, and she's hunching her back and actually making the udder a little bit further away. So some of these situations are a bit of a learning experience, and they have to kind of get used to what it's like having lambs on the ground. But again, the inexperienced first-time moms can be a bit of a challenge with some of these. So that might be where timing your breeding of ewe lambs separately from ewes that have already been around the block a bit can allow you to pay a little bit closer attention to those animals so that you can make sure that they are bonding. Low birth weight can be from a number of reasons. We'll get into some of that a little bit in the next couple slides. But if we have, really high litter sizes, it can decrease birth weight of the lambs and kids born. Or if we have impaired nutrition. So if we're not meeting their nutritional demands at the end of gestation, which is when most of that growth occurs, we can have low birth weights. And other challenges with that, like someone put in here vitamin E and selenium deficiency. So that causes weakness in lambs that can be because of nutritional deficiencies. All right, weak lambs again. So a lot of our infectious abortion agents like chlamydia can't be Coxiella, which causes Q fever, and toxo. If they don't cause abortions, they can cause weak lambs and kids that are born from dams that were infected. So that's probably one of the most common reasons for weak lambs being born. White muscle disease or vitamin E selenium deficiency is another reason that you would have weak lambs, and may not be able to get up as quickly and nurse as efficiently as lambs that have a normal vitamin E and selenium status. Okay, so talking about trauma at birth, one of the most common traumatic injuries that we see is rib fractures. And my internet is not cooperating. It should be playing a video. So let's see, hopefully you can see this video where this lamb was born alive, had been up nursing, and now has basically what's called a flail chest, where the ribs and the abdomen are moving opposite of one another when the lamb tries to breathe in. And that is a sign of air being inside the thoracic cavity. Long bone fractures can happen either with assisted delivery, or if the mom is being a little bit too aggressive after delivery, trying to get the lamb up. they can get fractures of their limbs, which can make it, obviously, if they're fractured, they have a hard time standing. Even with casts on, they can have a really hard time getting up and nursing. So a trick that a shepherd taught me is to use these padded aluminum splints that are sold on Amazon for survival kits for hikers and things. They're aluminum, they're very light, and they're already padded, and you can just cut them with some good strong scissors down to size, which is perfect for lambs because you can make them the right size, and then they're not too heavy. We oftentimes get a little bit too ambitious when we're casting lamb legs, and the cast or the splint that gets applied is just too big for them to be able to get up and run around and nurse. So we really want to make sure that the animal, if they do have a fracture that we're able to splint, can still get up and nurse to protect themselves from starving or getting cold. Okay. So pneumonia, the most common causes for pneumonia are aspiration, and then our typical respiratory pathogens like Mannheimia. The risk factors that are involved with pneumonia are barn ventilation. So if we don't have great cross ventilation in a barn, ammonia tends to accumulate, and the ammonia in the air, which is what we can smell, it burns basically it interacts with the mucosal surface of the lungs and damages it and just makes it more vulnerable to infection, right? Because the lining of the bronchioles are meant to be able to move mucus and pathogens up and out. But if those are damaged, then we're not able to do that as well. Inadequate colostrum intake, so that can be, again, because we have really big litter sizes and there's not enough to go around, or potentially the quality that the ewe is making, so it doesn't have enough antibodies in it in concentration to help protect the lamb or the kid from infections that it might be presented with. Again, white muscle disease shows up, and that has to do with muscle weakness. So if the lamb or kid is not able to suckle as efficiently and swallow at the same time, it takes a lot of muscle coordination to make that happen. They can aspirate milk, even though they're just, trying to do normal nursing behavior. The milk can go down the wrong pipe and into their lungs. And as you know, milk is a great medium for bacterial growth. So pretty quickly we can get bacterial pneumonias. And then, of course, tube feeding weak lambs can have its risks with also aspiration pneumonia there. So not only if obviously we go into the wrong tube, so if we're not sure we're in the esophagus or in the trachea, obviously that will cause milk in the lungs. But even if we are in the esophagus, if we either have a lamb that doesn't have a great suckle when we're tubing them, the muscles that are involved in that suckling behavior also kind of are a sign of how much muscular capacity their esophagus has. And so if they aren't able to make a good suckle, the ability of them keeping milk down in their stomach isn't as great either. So they're more likely to regurgitate that milk back up and aspirate. Or if we don't kink the tube, when we're pulling the tube out, we can get a little bit of milk in the back of their throat, which can impact that as well. All right. So septic arthritis, we have most common bacteria that we see are E. coli and staph bacteria. They tend to be on the skin and in the environment normally. Chlamydia carinii, which causes CL, and then erysipelathrix and mycoplasma tend to be herd dependent. So if those bacteria are in the environment and kind of circulating within the adult ewes, then we might be more likely to see those bacteria causing infected joints or infected umbilicus. So I put infected mother's milk as one way that they can get those bacteria into their circulation that then settle into the joints, because mycoplasma is one of those bacteria that they can actually be exposed to from if the dam has mycoplasma. A little bit more commonly seen or diagnosed, at least in goats, than it is in sheep. And then our kind of traditional navel ill is when bacteria are in their environment and then it goes up through their umbilicus and into their circulation that way. We can also have, so the way to prevent that is with a good umbilical disinfectant. And depending on your environment, a dip is okay, and sprays are okay, as long as if we're using a dip, we're not putting the umbilicus in that one jar or container that contains all your dip. Because if you can imagine, now you've contaminated all your dip that you're going to have to use on all your other lambs. So the best way to use a dip is to have a dip cup that then you can clean between lambs. That is hard for people who have a lot of lambs and kids in a day to be cleaning cups between lambs. So a lot of folks are using sprays now, which is great, as long as we're getting good coverage of the entire umbilicus. So we actually do get good drying of the umbilicus after spraying. Tail docking sites can be another site for introduction of bacteria, and then castration sites as well. This is a lamb that has tetanus, which is a clostridial infection. And that's an example of an infection that they can get from a tail docking or castration site, especially if we're using bands. So just a note to make sure, that we are up to date on our CD&T vaccines. If we are processing lambs in that 24, 48-hour period, or castrating goat kids within that period, then we're going to want to make sure that the mothers are vaccinated before lambing and kidding, so that they have those antibodies in their colostrum to protect them from this infection that can happen during processing. Okay, so scours within the first week of life. It's not super common to have scours within 24 hours, but we sure can see it within the first couple days. E. coli is the most common cause of scours in our lambs and kids. We can also have clostridial infections, type C most commonly in our really young lambs and kids. And again, if we are seeing that, then we want to make sure that we are vaccinating the does and ewes before lambing and kidding, so those antibodies are in the colostrum. Rotavirus, coronavirus, and cobuvirus are also they're viral infections that can be in a barn environment that can spread pretty quickly, very contagious, and tend to affect newborn lambs and kids. And then salmonella can cause diarrhea at any age. Cryptosporidium, typically we don't see signs until about 10, or we don't see the parasite in the feces really until they're about 10 days of age. But if there's a lot of crypto in their environment, we can start seeing losses of kids by 5 days of age, if they're being infected immediately after birth and with a huge load, that can affect them even faster than the parasite makes it to the back end, if that makes sense. And then if we are raising lambs and kids on the bottle, so artificial rearing, then nutritional diarrhea is one of the most common reasons to see scours in these young animals. Sometimes it might just be from transitioning them from the dam if they've started suckling to the milk replacer that we're using. That takes a little bit of time to adjust sometimes. But if we are seeing diarrhea with artificially raised animals, really important to, especially if we're having losses with scours, important to submit any lambs or kids that die to a diagnostic lab to rule out some of these other causes and make sure if it is nutritional, we want to make sure that we're mixing the milk replacer exactly to the directions on the bag of milk replacer. And frustratingly, every milk replacer bag can have different mixing directions. So just making sure that we're actually following the one that we're using. All right. So the risk factors for increased mortality, we mentioned a few of these. So low birth weight, again, has a lot to do with the ewe's body condition score, especially in that last trimester of pregnancy. We do tend to see more low birth weight in lambs and kids that are born later in the season. A bit of a conundrum there if that, usually the feed gets a little bit better the later in the season. If it's because of parasites tend to increase also later in lambing and kidding season. So there's probably a couple of different reasons for lambs and kids that are born late in the lambing and kidding season for them to have lower birth weights. But again, litter size, and I think this photo on this slide is just so impressive. This ewe had 5 lambs, and just you can see how sunken her abdomen is, and just like how it must have just been all full of baby. So just the fact that she was able to deliver all of those on her own, and have enough hopefully nutritional capacity to get them to that point. Don't worry, she did not raise all of those on her own. That would be a feat. So low serum IgG, so that is basically failure of passive transfer or inadequate colostrum, and that could be because the ewe has mastitis, can't produce good quality colostrum. We see this a little bit more with either early or late in the lambing season. And typically I think of early ones, we tend to have, and probably everyone sees this, you have more of your abortions / weak lambs, so probably born a little bit earlier than their actual, than they were meant to be in there, if that makes sense. So they're a little bit undercooked. The ewe or doe, her udder may not be fully ready to go into colostrum or milk. So that might be why we see a little bit of that at that time. And then again, litter size, just because there's not enough colostrum available for all of these lambs and kids that are born. Again, the inexperienced ewes or poor udder conformation. So ewes that won't let lambs nurse, or udders that have teats that are a little, especially if we have a break in the median suspensory, our teats tend to go out towards the knees of the mom, and those are just not easy for lambs and kids to get to. And then it's in the literature, but male lambs also tend to have a little bit higher rate for increased mortality. All right, so how do we help them through this? Some things just to be aware of for colostrum requirement. Hopefully these guys are up and nursing soon after birth. We, in order to get enough antibodies across that gut while it's open, they need to have at least 1 ounce of colostrum per pound of body weight within the first 2 hours. I know traditionally we've always learned we have 24 hours to get colostrum into them. Well, I'm sure you've heard more recently that we really want enough into them by 6 hours. And that is because other organic material, whether they're sucking on wool or dirt or, kind of just trying to eat anything around them, that those sort of materials will stimulate the gut to close sooner. And at 6 hours is kind of when the stomach starts producing digestive enzymes and things that will begin to start denaturing or digesting some of these antibodies that we need to cross the gut barrier. So a good aim is to make sure they're up and nursing within 2 hours. And if we haven't observed this, then maybe we ought to intervene and try to get some colostrum into them. Ideally, it is mom's colostrum if she has it, because that smell of her own milk going into the lamb or kid helps with that bonding process. So especially if it's an inexperienced dam, and that's why they're not able to nurse within a couple hours, that can help with that bond. Otherwise, if she doesn't have good colostrum, or she has too many babies to be able to feed all of them, then it's a good idea to have either a bank of colostrum from other ewes that have just a huge supply. You can keep it in the freezer for a year, and it is good in the refrigerator for 24 hours, and then you can freeze it after that. There are colostrum replacers. I would just be really careful if you are using an artificial source of colostrum, make sure it is a colostrum replacer and not a colostrum supplement, because colostrum supplements don't have enough antibodies to actually protect the lamb or kid. Just a note about we know that colostrum has a really high level of fat and protein, not even proteins that aren't antibodies. There's just a lot of nutrients in colostrum. And I just thought it was really interesting that ambient temperature has a lot to do with what their colostrum requirement is to keep their temperature in check. So I thought this was a really interesting graphic about their metabolic rate at different temperatures. So there's a lot going on here, but the line on the very bottom shows ambient temperature. So as ambient temperature moves towards the left, it's getting colder, and their metabolic rate goes up a whole lot when it's cold to try to keep them warm. They will shiver, they'll try to be a little bit more active. A lot of those, their metabolic rate will go up to be a little bit more exothermic, to keep their core temperature warm. So at an ambient temperature of 64 to 80 degrees, their typical requirement would be around 5% of body weight within the first 18 hours. Now that's just for metabolic needs, not for the antibody requirement. But then as temperature goes down, that requirement, quadruples. So it's just so impressive how much more intake they need when temperature goes down. So a trick that I know a lot of folks here do when we're anticipating storms at night, if the animals are outside, is they'll go and get moms and lambs or does and kids up in the middle of the night, because if they're standing, then the lambs and kids have an opportunity to nurse. So especially animals that will tend to want to bed down when it's stormy to kind of brace themselves against the storm, it is important to get them up to allow babies to nurse so that they can, provide the energy needed to keep their core temperature high enough. All right. So, and then maternal nutrition, again, is really important in the last 3 weeks of gestation to help impact the quality and amount of colostrum that she's able to produce. All right. So how can your vet help? We'll talk about some things that we can do to help prepare for a lot of these things that are common. And usually we like to prepare for these things long before lambing. So this is a picture of a scanning chute that we have for scanning pregnancies. We can count fetuses between 45 and 85 days of gestation. And by counting fetuses, we might be able to better feed these moms for their energy demands at the end of pregnancy. We can also prepare even before that and have a breeding plan that maybe allows them to have different lambing groups to either, if we are lambing in a barn, to make sure that our barn doesn't go over capacity when we're, if we're in peak lambing and we have, a barn that holds 100, or let's say 20 lambs, and we have 100 ewes to lamb out. If we lamb all those ewes out in a week, we're really pushing that capacity. But if we can spread them out over 2 or 3 weeks, then we'd be a little bit better off moving these lambs through the barn every couple of days. So just a way to think about that. And then we like talking about the, even before that, when we're planning our breeding season, helps us to plan our lambing, and we want to make sure that we're lambing at a time where we can accommodate their nutritional needs. So they're going to be the highest nutritional demand at the end of gestation and into lactation. So we want to make sure that we're planning that when we have access to, if we're on pasture, to pasture that's growing at that time, or if we are bringing feed in, to make sure that we have good nutrition available for that period of time. We can review our annual plans with our veterinarian, make sure that we're meeting kind of our measures for production, so that we're staying good and we can make adjustments if needed as we go. All right, so pre-breeding management. This is when it's a great idea to look at body condition score. So we know that if we have skinny ewes that are thin at breeding, so they didn't recover the weight loss, we expect ewes to be a little bit thin at weaning, right? Or does, so that, if they're raising triplets, that's fair. They can lose a little weight. They've put all their energy into milk production, but we do expect to regain that condition by breeding. If she can't do that, then it's a sign that something else is going on there. So good idea to, investigate, figure out what is underlying the poor condition there. Is it parasites, or is it one of the chronic diseases that we deal with in sheep and goats, like Johne's disease or CL? And then, if she has those diseases, she's more likely to pass it on to her lambs or kids if we keep her as a breeding animal. So this is an image of, the body weight of these animals as they go through their production year. And then above is the body condition score that we typically see with animals. So like right after lambing, they'll drop. Right around weaning, they may be around even a 2. But again, we expect them to recover by the time we're breeding. Udder palpation is another good practice to get in the habit of before breeding. If she has a hard udder or a large udder before breeding, and when, again, she should have been dry for a number of days, that's a great time to say, okay, I don't think this animal is going to be able to make enough milk because she's got issues with the udder here. And then if we have history of abortions with chlamydia or CAMP, that's a great time to be vaccinating for those. Okay, and late gestation. Again, I don't know how many times I've said nutrition in late gestation is important, but hopefully that is landing. And you all already know that. But we, certainly calories, energy is extremely important and hard to achieve when we have an abdomen full of fetuses. So making sure that they're getting a diet that is what we would call energy dense. but also adjusted to that diet over time, because we know how the rumen doesn't like sudden changes. And then micronutrients to make sure that they have during gestation would be iodine. We can see milk, or we can see goiters in lambs and kids that are born if they have low iodine. And then selenium, vitamin E again, and then copper. If animals are deficient in copper, it's more commonly seen in goats. The kids will be born normal, but by the time they get to about 6 weeks, 4 to 6 weeks of age, they start doing like a bunny hopping type thing. It's another name for the disease is enzootic ataxia. But it basically, the spinal cord doesn't develop normally after they're born. And so then we get progressive weakness of the hind end, and it is not something, unfortunately, that we can treat. So making sure they have the right minerals in front of them throughout their pregnancy is incredibly important. And then vaccines that you might consider giving in late gestation would be your CD&T. And then if we have big problems with mastitis or pneumonia, even sometimes J5 vaccines in late gestation can help with antibodies to these gram-negative bacteria that are responsible for E. coli mastitis, E. coli scours, or it may help improve recovery time for pneumonias if we have a big problem with pneumonia in our week-old lambs and kids. This would be another time to shear or crutch or clip our animals to clean up their udders and their rear end to make sure that we're really minimizing the contamination of the udder. Wool can hold a lot of moisture, and so we want to make sure that when those kids are born, if they are being dam raised, that they have a clean environment when they're searching for that colostrum. This is a graph that shows how birth weight actually contributes to mortality. So when we have low birth weights, we tend to see higher mortality rates. And then we have a bit of this sweet spot in the middle where they tend to do pretty well. And then higher birth weights can also have higher mortality. And this may be more related to difficult deliveries and poor oxygen delivery or supply when they're being born. So they become slower, they don't get up as fast, all those things. Okay, lambing and kidding shelter. We went over this. Best shelters, full belly of milk. There are lamb raincoats, so Shearwell makes them. I've seen wool coats, and those can really help, especially when it's raining, to help insulate lambs. Portable jails can be helpful as well to make sure that they don't have to travel too far. And then also planning your paddocks so that ewes and does always have enough forage around them, so they don't have to go too far away from their lambs and kids to be able to get a full belly of food. We want to make sure that we are managing our ewes and does to be able to raise their own. Ideally they have their own baby on their own without assistance. They mother up well, produce enough milk, and then they wean at least one kid every year. So these are traits that we can monitor and help select to make sure that we're breeding animals that are going to improve the animals that come out of that. So lamb vigor, these are all maternal traits. Lamb vigor certainly can be a component of those maternal traits, but there is evidence lamb vigor is also kind of on their own accord. So, maybe there is some, the buck has some responsibility as far as how much vigor their lambs have when they're born, which is really exciting, because if that is true, then we can actually influence a lot of our lamb survival by the breeding programs. But we do have to have progeny information to be able to determine that. This is an easy lamb or easy care lambing system that my friend Dan Macon likes to use. And this is how he is making sure he's selecting for ewes that are able to raise lambs. And this has really made a big impact in his operation for ewes that can raise lambs reliably and have little assistance. This system was developed in Scotland for the hill sheep. All right. And then shed management, if we are lambing and kidding in barns, it's really important that the environment that they're in that first 24 hours is clean and dry. So if we're doing jug lambing, we want to make sure, or even if we're lambing outside and bringing them in, we want to make sure they come into a clean, dry jug. So it's been cleaned between ewes as they're rotated through. And then, sheds certainly have benefits for being able to identify animals that need assistance during lambing or kidding, and then treating lambs and kids early because, if they're inside, we're more likely to be able to see them and hear them and observe normal behaviors. All right, so protocols and decision support tools are really important to have set up before we get into this busy, sometimes stressful season. It's a joyful season, but there's a lot going on, right? So we want to make sure that we have all of our supplies ready, that we've, got everything that we might need kind of set up ahead of time. And then identifying diseases that are common for your operation, and then having treatment protocols set up so that you have drugs on hand would be really helpful. So this is an example of a lamb triage chart that I developed for our research facility here in California. So this kind of helps them. It's a bit of a decision tree to help them identify, okay, what can I do to figure out what's going on here, and then follow that protocol, and then what to do next. All right, and then as we get into weak neonates, it's really important to identify if they are hypothermic. So if they are hypothermic, if they're less than 6 hours old, it tends to be a primary hypothermia. So I keep saying weak neonates and they need to get up. So these animals that are less than 6 hours old, if they are down on a cold surface, they have such a high surface area to body volume ratio. So because of all that surface area that's touching a cold ground, they lose body temperature super fast. So while they're born with a brown fat that actually produces energy, or not energy, it produces heat when it burns off. But if they're cold from the get-go, it burns off really fast and before 6 hours. So it might, it's not necessarily that they're that they may not have nursed, but they may not be primarily low in sugar. They're just frozen because they're not really able to shiver yet to keep their temperature up. So with those lambs, the approach is a little bit different than older lambs. Older lambs usually are starving, and that's why they can't keep their core temperature up. So usually we need to, obviously first we need to get their core temperature up, but then figure out why. Because usually with older lambs, there's a reason why they're cold. Either they have sharp teeth and weren't able to nurse, or all those other reasons we listed. So if these lambs are cold, but they still have a suckle, we want to tube them with colostrum, and it should be warm colostrum to make sure they have an energy source before we bring their metabolic rate back up. If they don't have a suckle, there's a number of resources for this, and I don't think this video is going to play because my internet or something is not working super great, but we do have a link that hopefully I'll put it in the chat, or if someone can put it in the chat, that would be great for everyone. Let me see if this will work. Yeah. that way. It's a great video to show how to give an intraperitoneal injection of dextrose for cold lambs before we warm them, because if we warm them and they were starving, they will have seizures and die because they have no sugar to support a higher metabolic rate. So there's all kinds of resources online for how to do this. This video, again, is a great example, but it's 20% dextrose. Omafra from Canada has a great pamphlet on how to do this, and then giving it in the belly to make sure that they have enough energy. All right, so in order to warm them, how are we going to do that? It does need to be a little bit slow, so it does take time. Usually takes half hour to an hour to get them up to temperature, depending on how cold they are. I really like using warm water baths. There are warm air box designs that people are really successful with using, or potentially heating pads. I've seen heated stall floors and things like that. Those are heating pads, I wouldn't say are super great for, and that said, heating pads and heat lamps aren't great for warming cold lambs. We do need a little bit more kind of circulation around them. This is a picture of a barn that actually had part of it burnt down because of a heat lamp. So heat lamps are the most common cause of barn fires. So that is something to keep in mind. If we do have heat lamps, we need to be super careful about using them. And then after the animal is warmed, then it is important to make sure that they do have warm colostrum or milk, depending on their age, inside their belly. This is one way to warm water baths, either for lambs or milk or colostrum, is with a sous vide. I think it is a really neat technique. Okay, so next, again, we talked about the lambing chart, but a little bit on the severe scours protocol. We don't have a lot of time for this, so I'll just go into it a little bit. If scours is a big problem on the operation, then just warming them and giving them a little bit of dextrose isn't going to help meet their fluid losses requirements. So with scours, we do have resources for calves that have been developed over a couple of decades, and I would like to start developing these for lambs and kids. So, what are their fluid requirements? What do we need to rehydrate them to correct their acid-base imbalance? You guys will get copies of these slides to kind of help you understand what their fluid requirements might be. What are they missing? So with acid-base abnormalities, this is a lamb that has diarrhea, and he looks like a lamb with pneumonia. So they can look very similar. Because of the acid-base abnormalities, their respiratory rate goes up to try to blow off some of that acid. So we lose bicarbon scours. They produce lactic acid from the bacteria in the gut, and then they can accumulate lactic acid that's produced from their tissues because they don't have as good of blood flow. They can have electrolyte losses, and then again, low sugars. So there are rehydration fluids that you can work with your vet to make sure that you have everything you need if you are wanting to be able to give fluids through an IP injection, if they're not strong enough to take oral fluids at that time. Oral electrolyte solutions are really important for kind of the continued care of these animals. If they're not, if they still have scours for a number of days, it's great to supplement them with oral electrolytes between feedings. Easier to do if they're bummer lambs, but can be done if they're still on mom but kept in a hospital pen situation. What's really important is that these solutions have an alkalinizing ingredient. So these are all alkalinizing ingredients. Bicarbonate wouldn't be my most favorite because it does tend to lower the pH actually in the stomach, which we need to keep acidic, right, to protect the gut from bacteria coming in. These acetate, propionate, and citrate are alkalinizing once they're absorbed. So the body takes them and then it makes basically a buffering environment. So you can see this one has acetate and citrate in it and no bicarbonate. This fluid has a strong iron difference of 70, which is ideal. So this is actually hydrolyte, which you can find. I'm not endorsing the product, but it is a great product. We use it. And it also has sugar in it, which helps absorb the electrolytes. So went a little fast at the end because I realize I am now out of time, but I do want to open it up and I can try to go through some of the Q&A with you guys if that's where we want to go at this point. So thank you very much. Tick-borne illnesses, there's a question. Is this a particular issue with pregnant does and ewes? I have seen, we talk about anaplasmosis potentially being an issue as far as causing abortions, and illnesses in goats, but I haven't really seen, we don't see a lot of it in California anyway. We have surveyed for it and just haven't seen a lot of it. And then okay, so there's a question about if mortality is more likely with sheep than goats in the rain. And interesting that your dad used to say that sheep could drown in the fields by looking up in the rain. What I have observed is that sheep are not as affected behaviorally by the rain. They will stand in the rain, probably similar to what your dad has seen. Goats tend to buck and run around like little crazy things. And if they have developed shelter-seeking behavior, they will go and find a place to get out of the rain. Sheep don't tend to do that as much. I don't know that mortality is higher in sheep from folks that I've talked to. They've had more challenges with their goats in bad weather. But maybe that's because they haven't been taught to seek shelter. But that is a good question. Any way to help the lamb with a rib fracture? That is challenging. Sometimes we can do that. The flail chest is really challenging. They do need to have the air evacuated, which means probably identifying where the air came in. Sometimes air, it's not from outside, it's actually the rib puncturing the lung. And in those cases, that can be really challenging. But probably something, if you have a vet near or a hospital near, that would need that kind of attention to do that. And then if you don't have access to BOCI for kids, which no one in this country does at this point because it seems to be on back order, would selenium gel or paste suffice? And interesting that you asked that. There's been a lot of discussion on the vet listserv, the American Association of Small Ruminant Practitioners, about just that. And in a bind, some of these gels can really help weak kids. So if you are seeing weak kids, every once in a while you can have, even if you're feeding a mineral, every once in a while you have animals that, are the percent that aren't eating enough mineral, even though it's available, and they will have weak lambs or kids. So it's a good idea to have a gel on hand because those can certainly help. Again, the best cure is prevention. So making sure that they do have mineral available, recognizing that they won't all eat all of it, unfortunately. So if you're using iodine as a dip, will it kill anything that might get in the bottle? That is a great question. To a degree, right? It is a disinfectant. but we see disinfectants inactivated by organic materials all the time. So a big problem that we have with disinfectant is, one, if the cups are left open and debris falls in, then we inactivate those disinfectants. So when we're using ones that have the cup, we want to empty it, clean it, and then lay something over the top of it. And then if we're putting umbilical cords into bottles of disinfectant, over time, we're going to deactivate that disinfectant. So you'll be more likely to see umbilical infections or navel ill as that lambing period goes on. So better to get in the practice of not doing that to make sure that we don't start seeing those problems. And then can we find, examples of navel dip products. I don't tie off the umbilicus. I don't feel that helps very much. And then we use 7% iodine. Some of the iodine formulations can be difficult to get, and you may need a prescription for them because of all of the controlled products, because of the other ways that these things can be used. So yeah, the 7% is a good one. It's not too strong. And especially if we're using it in a spray. It's best to make sure that we're spraying these or dipping these as soon as possible. The only time I would alter the length of an umbilicus is if it's touching the ground. So if it's, 6-8 inches long, then I'll cut it to where it's about 3 inches long. I don't like it too short though. I want to make sure it can dry before that highway gets short and those bacteria can get swept in. Okay, minerals. That is a regional question. So really good to get in touch with your extension advisor, farm advisor, extension specialist in your area, and they can advise you on mineral recommendations because it's so dependent on your soil types and things like that. But an important question to investigate. The lambing care chart system. You guys will get these slides, so you will have one. Oh, the easy care. Yeah, so that'll be on there. Do you have recommendations for kidding protocol and what to have on hand? I have resources for that from our lambing and kidding school, so I can probably share some of those with Carolyn and help, maybe Carolyn, that can help you make one for your area as well. But like a lambing kit or kidding kit, those are good to have. And then, oh yes, hello Sandra, wonderful. Great video, by the way. And then electrolytes given by IV, bottle, or drench. So the hydrolyte is can be given by bottle or a tube, depending on how willing the animal is to nurse off of a bottle. I do find it a little bit challenging to get lambs or kids that are on their mom to nurse from a bottle. And then, yeah, the rehydration fluid formula that I had there, that would be IV would be ideal, but in these kind of emergency situations when they're pretty dehydrated and their blood pressure is low, it can be a little bit challenging to find a vein for these lambs and kids without a veterinarian there. If you have your vet there, they have the training and experience to probably find one, but IP fluid administration is it's something that they even do in human patients, especially if they're burn victims and don't have good access to veins and things. So it is something that would be a good alternative just to make sure that they get a little bit of their fluid replacement to get them on the right track. High temperatures can certainly contribute to mortality because lambs and kids have a really hard time in the first couple of days, basically with thermal regulation. So we can see a little bit harder time, they may not want to get up and nurse as well because they're, a little bit sluggish. Flies and bacteria and all that can be a little bit challenging in hot weather. So that I have an experience with some lambing in June, and that was a little bit challenging for us for sure. All right, yes, downloading and laminating the triage chart would be good. If you guys have feedback on that, I'm trying to make them into templates for the what is it, the sheep quality assurance, so that we have those resources for you and your veterinarian to fill in for what works for you. So if there are things that I'm missing once the slides come out, please reach out to Carolyn or myself. That would be wonderful. And then difference in response to Clostridium vaccine between sheep and goats. Yes, goats do not develop long-term immunity like sheep do. So goats, if we have a problem with Clostridium in our adult goats, a good idea to vaccinate them more frequently. So, typically we'll recommend every 6 months. It may need to be even more than that if you're having a problem with Clostridium in your adult goats. We don't tend to see a lot of Clostridium in adult goats and sheep in California, but I've heard that it is a bit more of a problem in the Midwest. And then our bummer lambs and kids, we do see more clostridial infections with them. So we do tend to vaccinate them more often. Like when we're getting their vaccine series started, we'll do doses every 2 weeks to get them really for 3 doses to get them kind of up to speed. And then if the sheep are shorn, will they head for the barn when it gets cold? Yes, they do tend to. I say that in general. I don't know that, every sheep has their own behavior, so I can't guarantee it, but they will tend to seek shelter if they are shorn. There is a vaccine coming for Cache Valley virus. I can't remember the name of the company, but they are working on that. Any research on Pepto for scours? Yes, it is. It doesn't actually it basically doesn't do a whole lot for the fluid replacement or it basically has an anti-inflammatory effect on the gut. So for those viral, the rota, corona, and corbu virus, Pepto can help with some of the inflammation that happens there, which can really be the reason for the pathology that we see. Other bacterial infections, Pepto may not help a whole lot, but it may not hurt either. And then Vimco mastitis vaccine and boluses instead of mineral. The Vimco mastitis vaccine, I think, is wonderful that we have it licensed here. This is the vaccine that is for staph infections. So for Staph aureus mastitis, coag-negative staph. If we are using it for animals that have Staph aureus, we want to be really careful about vaccinating adults that have Staph aureus because it will increase your somatic cell count. If we are using it to control coag-negative staph infections, then we're pretty safe vaccinating everyone. If we do have a Staph aureus problem, then we want to start that vaccine program with doelings that haven't freshened yet. So they're less likely to have Staph aureus in their mammary system. And then boluses, personally I'm leery on boluses just because of the grazing systems we have here where animals are changing forage types really frequently. So I always worry that we're never really hitting the mark with, you'll see a lot of times in our grazing systems that animals will go, increase and decrease their intake, kind of depending on what their forage quality is like out. where they're eating. A bolus, we're pretty committed. The times where I do like boluses is if we're grazing sheep and goats together, and goats have a higher copper demand. And if we're worried about copper toxicity in our sheep, I don't like putting a mineral out that has a level of copper that the goats need. So I will recommend copper boluses for the goats that are being grazed with sheep. Other than that, we don't have a lot of options for boluses here in the US that I'm aware of. Mastitis. I think it would be good to get an idea of what is causing your mastitis, because if it is not a gram-negative bacteria, then the J5 vaccine is not going to help you. And that's true for the infected joints and the scours. If you're starting to notice a problem, it's really good idea to submit samples so that you can be more targeted in your approach. But really great question. And then we supplement with feed. We have certainly seen more mastitis in sheep, especially on really good feed years. So it could be related to production, like basically producing more than the lambs and kids are able to nurse. So that could be one problem, that we just have milk sitting in the udders. The other problem too is our udder conformation. So that's just something to keep an eye out. If we, and I'm not familiar with your operation at all, but if we have sheep that have teats that are up here, this whole dependent part is milk that's just sitting there. And if the lamb's not nursing it dry, it's sitting there between feedings basically. And so we're more likely to have mastitis if the lambs aren't able to consume everything that's in there. And you're likely to have that when you have that broken median. And if that median suspensory is broken, it's probably because she's a great producer. So I'd encourage anyone who's breeding sheep to really start focusing on that lateral suspensory to help even out the support system for the udder of sheep. I would love to see that, so that we can have sheep that produce enough milk, but have good conformation that can support that milk production. Plastic shot glass as a dip cup. That's a perfect idea. Yes, wonderful. And then navel. Yeah, I agree. So tearing, if we have to, or if we're cutting, it's better to cut on a diagonal than straight across. Sorry, I said that wrong. We want to cut straight across. If we are cutting, we want to cut straight across so that those vessels are more likely to kind of contract down. And we want to cut with something like scissors that will crush as we're cutting. So that is good. Dr. Baxendale says that she uses a meloxicam gel product that's only available in Australia on does that are about to reject a kid, and she finds that it helps with probably painful teats. That's wonderful. And then the emery board, yes, it's funny. I work with some folks that every couple of years they have to remind themselves that sharp teeth are a thing, and because they forget to check. And so yes, definitely important. All right, and then yogurt and kaopectate for older lambs that get scours. That seems wonderful. A little bit of I haven't used yogurt, but I know there are also probiotics out there that can help as well. Yogurt's the same idea. So do you have recommendations to help use bond with lambs? This is this is a challenging question because they're all a little bit different. But if we have ewes, I think the best thing is trying to make sure that we can get the lamb to nurse on the ewe. Because again, once that milk starts coming out the back end and they smell it, they may be more likely to identify it as theirs and bond with it. And then also that act of nursing or milking the ewe helps promote oxytocin production or secretion, and we're more like, the oxytocin is like the love hormone, so more likely to get some bonding behavior there. If it's not working, I have tried giving low doses of oxytocin to animals, especially like first time ewe lambs and doelings that are really struggling. Sometimes a little bit of oxytocin injectable can help get that bond to form. But again, that would be something you'd want to work out with your vet as far as how much you'd want to give and how often and when you would be giving that. But really that nursing and getting that milk into their lamb can help. Wonderful. And then would I know what caused lambs to be born without limbs? There's a lot of reasons why we have birth defects in lambs and kids. The first thing that comes to mind is Cache Valley is one of the most common reasons for deformed lambs and kids. So that is something that your lab can diagnose potentially, but yeah, that would be probably a common infectious cause, but then there's other, just the more lambs and kids that are born, the more chances there are for having the anomaly. Then antibiotics do we recommend to have on hand after discussion with the veterinarian? I would leave that up to you to discuss with your veterinarian. If your veterinarian has questions on that, I'm happy to talk with your veterinarian. I'm sure there are veterinarians, if you're not in California, in your state, that are happy to talk to some regional considerations with some of these diseases, and what's available to them. But yeah. And then, will the mastitis vaccine be made for sheep? I don't know. That's a challenging one. I have a lot of optimism for the future vaccines for sheep and goats, but I just tend to be optimistic. So the ability for us to get vaccines licensed in this country is pretty challenging. So, but we can use vaccines extra label if we're working with a veterinarian. So let's hold on to that. And then, oh, oxytocin up the nostril. I've not heard of that one. I tend to give drugs either, in the muscle or IV, just because if I'm paying for it, I want to make sure it gets in there. But that's just me. So anyway, thank you guys so much. I really appreciate all those questions. Sorry for going over so much. All right. Wonderful. Well, thank you all for your feedback. And we'll get those slides to Carolyn.